We've all been there, right? Or at least we've seen it happen. A sudden slip, a twisted ankle, that awful sound during a sports game. And in that split second, one question pops into your head. What do I do right now? Well, in this explainer, we're going to build a super simple, clear framework for exactly that moment.
I mean, really think about it. That crazy moment, you twist your ankle on a curb, a kid takes a tumble off their bike, or you hear that unmistakable pop from across the field. The first instinct is often to panic, right? But you know what's better than panic? A plan.
And that's exactly what we're going to give you. In just the next few minutes, you're going to get a straightforward framework that'll give you the confidence to know what you're looking at and what the right first steps are. So, let's start with spotting the really serious stuff. Okay, first things first. We have to figure out how serious this is. We're going to start with the big ones, broken bones and dislocated joints. Knowing the difference here is, and I mean this, absolutely key for what you do next.
So, a fracture, it's just a fancy word for a broken bone. But for you, as a first responder, there's one critical detail you need to look for. Is it closed, meaning the skin is still intact? Or is it open, and this is the scary one, where the bone is actually broken through the skin? An open fracture is a huge red flag, because the risk of infection goes through the roof.
Now, a dislocation is a whole different ballgame. This isn't about a broken bone, it's about a joint that's been knocked out of place. The bones literally get forced out of their normal spot, their socket. You know when a shoulder or a finger just looks wrong? It's a joint problem, not a bone problem.
So how in the world do you tell them apart? Well, honestly, both are going to cause intense pain and a deformity you can probably see. But here are the clues. With a fracture, you might, and this is kind of gross, you might hear or feel a grating sound if the bone moves. But with a dislocation, the person might say they feel numbness or tingling. That's a sign that nerves around that joint are being pinched, and that's a really important detail. All right, let's step back from the really dramatic injuries and talk about what you are way more likely to see day to day. You know, sprains, strains, and bruises. These are all what we call soft tissue injuries. A sprain, this is all about your ligaments. Think of ligaments as these super tough rubber bands that connect your bones together at the joints. When you twist an ankle, you stretch or even snap those rubber bands. And yeah, that pop sound people talk about, that's a classic sign of a sprain. A strain sounds similar, but it affects totally different parts. A strain is an injury to a muscle or a tendon. And a tendon is like the rope that attaches your muscle to your bone. So think about pulling a hamstring when you're running, or straining your back lifting a heavy box. That's a strain. So what's the difference? It all comes down to one thing. Location, location, location. A sprain hurts around a joint, your ankle, your wrist. A strain, you're going to feel that pain and maybe even spasms in the muscle itself. You just got to ask yourself, does it hurt at the joint or in the muscle? And then we have the simplest one of all, a contusion. We just call it a bruise. Pretty straightforward, right? It's just some bleeding under the skin from a direct hit. It's simple, but it still hurts, and it tells you that area took a good whack. Okay, so we've identified all these different things that could be wrong. Now for the million-dollar question, what do you actually do? Well, for most of those common injuries, sprains, strains, bruises, your go-to response can be summed up in one easy-to-remember acronym, RICE. This is your playbook. 4 simple steps. R is for rest. Stop using the injured part. Easy enough. I is for ice. Get a cold pack on there for about 15 to 20 minutes every couple of hours to help reduce that swelling. C is for concretion. A snug elastic bandage gives support and also helps keep swelling down. Just make sure it's not so tight it cuts off circulation. And finally, E is for elevation. You want to get that injured limb up above the level of the heart. Gravity is your friend here. It helps drain all that excess fluid. Look, RIC is fantastic for most minor stuff, but maybe the most important skill you can have is knowing when an injury is not minor. So let's talk about the absolute deal breakers, the red flags that scream, stop what you're doing and get professional help right now. If you see any of these, the game is completely changed. We're talking severe pain that just won't quit, a limb that is clearly bent or out of shape, if they can't move it or put any weight on it. If there's numbness, and here's the big one again, if you see bones sticking out of the skin. All of these mean this is a medical emergency. Your job is not to fix it, your job is to get them to someone who can, and fast.
Okay, now we need to talk about 2 very special situations where the stakes are as high as they get. I'm talking about head and spinal injuries. In these cases, the rule book, you basically throw it out. The rules are totally different.
And let me be 100% clear on this. If there is any chance of a spinal injury, a bad fall, a car wreck, anything like that, there is one rule and only one rule. Do not move them. Period. Your job is to hold their head and neck still, and that's it. Wait for the pros. Moving them could cause permanent, devastating damage.
And for head injuries, the red flags are just as serious. If the person loses consciousness, even for a split second, that's a huge deal. If they're confused, if they keep vomiting, or if you see any clear fluid coming from their nose or ears, that could be spinal fluid. All of these signs point to a possible brain injury, and that means a trip to the emergency room, no questions asked.
And really, that's what this all boils down to. You're not supposed to be a doctor. Your job in a first aid situation isn't to make a perfect diagnosis. It's to recognize the signs, provide basic safety and comfort, and know when it's time to make the call for help. That's it. And that's huge.
So let's put our whole framework together. It's simple. First, you assess. What am I looking at? A bone, a joint, a muscle? Then for most things, your action is RICE. But you've always got to be alert for those big red flags that tell you to get help. And the golden rule, safety first. You never ever move someone if you even think there might be a spinal injury.
You know, this isn't just a bunch of facts. It's a tool. It's what turns you from someone who freezes into someone who can actually help. You've got the playbook now. So the only question left is, when the time comes, are you ready to make the right call? Because having this knowledge could make all the difference in the world.